Hi fellow future RNs! Alam niyo ba kung paano tumitibok ang puso natin? Nope. Hindi dahil sa mga crush niyo, hindi dahil sa mga opa niyo, at lalong hindi dahil kay Chen Ziyuan. Heist. Sorry, ang ante niyo kinain na ng K-drama, Chinese drama. Okay, so there are many factors that affect our heart rate. Internal and external factors that can either increase or decrease our heart rate. But the heart actually has its own system to keep it beating from the very first day it started functioning until the day we die. Okay, so today let's talk about the electrical conduction of the heart. So the heart's pumping action is regulated by an electrical conduction system that coordinates the contraction of the various chambers of the heart. Okay, few things to remember before we start, no? First is your SA node, or the sinoatrial node. Okay, this is the main pacemaker of the heart. It is located in the right atrium, malapit sa entrance ng SVC or your superior vena cava. The sinoatrial node initiates heartbeat and determines the heart rate. Okay, ano pa? The SA node generates 60 to 100 beats per minute. Kaya nga ba yan ang ating normal heart rate? Okay, next is the AV node or the atrioventricular node. Ano naman ang ginagawa ni AV node? Okay, AV node delays impulses. Okay, once ma-receive niya ang impulse from the SA node, i-delay niya ang impulse bago niya ipasa dito. I-discuss natin kung paano pagkasunod-sunod. Basta ang gagawin niya is i-delay niya ang impulse to allow time para makomplete ang emptying ng atria at makomplete ang filling ng mga ventricles. The electrical activity of the heart is reflected or makikita natin sa ECG. Kaya naglagay ako dito ng basic lang na normal na ECG. Okay? Disclaimer, hindi po ako maalam no sa pagbasa ng mga ECG. So, yung basic lang to, yung normal. I-connect lang natin siya sa electrical conduction of the heart. Okay, so, the very first electrical stimulus, or electrical impulse is generated by your SA node. Kaya nga siya main or natural pacemaker of the heart. Okay, so sa kanya manggagaling ang first impulse or ang first electrical stimulus. Kapag nag-fire si SA node, it will cause the contraction of your atria. Okay, so para mailipat, ma-transfer na atria ngayon yung blood to the ventricles. Okay, and that includes of course your right and left atrium. Okay, now, contraction of your atria is also known as the depolarization of your atrium or the atrial depolarization. Makikita natin yan sa ating ECG. Diba sa ating ECG, we have the P wave, the QRS complex, and the T wave. So the atrial depolarization, dito makikita sa iyong P wave. Okay? The P wave represents atrial depolarization. Okay. Once mag-fire na sa SA node, ang impulse or ang electrical stimulus mapapasa kay AV node or your atrioventricular node. Ano naman ang gagawin ng AV node? Na-discuss natin kanina. The AV node will delay the impulse to allow the complete emptying of your atria and the complete filling of the ventricles. Kasi ipapasa na ngayon yung blood, di ba? So, after nyan, once okay na, no, na transfer na lahat ng blood to the ventricles, mapapasa ang electrical stimulus to the bundle of His, furtherly divided to right and left bundle branches, and then to the Purkinje fibers. Kapag ang stimulus ibinigay na ng AV node, papunta ng bundle of His, the bundle branches, and the Purkinje fibers, that will cause your ventricles to contract naman. No? Kanina, sa SA node, ang nag-contract is your atria. Now, ang magko-contract na is the ventricles. And that is called your ventricular depolarization. Saan naman natin yan makikita? Makikita natin yan sa ECG, sa QRS complex. Because your QRS complex represents you have the ventricular depolarization or the contraction of your ventricles. So, kapag nag-contract na ang ventricles, syempre masisend na ang ating blood, no? From the right ventricle, pupunta sa lungs, from the left ventricle to the systemic circulation. After mag-contract ng ventricles, after ma-push or ma-pump na ang blood, syempre mag-relax na ang ating ventricles. And that is called your ventricular repolarization. Repolarization again, and that is represented in the ECG as the T wave. Again, the T wave represents your ventricular repolarization. Bakit nga kailangan mag-rest, mag-relax? Of course kasi, after kay Purkinje fibers pala, yung electrical impulse another impulse will start again. Uumpisan ulit ni SA node mag-generate ng electrical impulse unto the AV node, to the bundle of His, and so on and so forth. That's what happens every cycle. So every cycle represents also every heartbeat. So every heartbeat, ganun ang nangyayari. So from the SA node, AV node, to your bundle of His, left and right bundle branches, and the Purkinje fibers. Again, sa ECG natin makikita ang electrical activity ng ating heart. We have your P wave, your QRS complex, and your T wave. Your P wave represents your atrial depolarization or the contraction of your atria. The QRS complex represents your ventricular depolarization or the contraction of your ventricles. And the T wave represents the ventricular repolarization or the resting phase or the relaxation of the ventricles. Okay, that's it. Thank you. Bye.